Hello everyone, I am Dr. TK Umashankar. I'm in KIMS Gachibowli. So today I'm going to speak about the most common condition what we see nowadays is hemorrhoids, what we call as a piles. Okay, so now we have to understand what is piles, how it is formed, what are the causes of the piles, how we diagnose that you have a pile, and how you go for treatment. So piles is a condition where the veins in the lower anal region they become enlarged. Why they become enlarged? There are multiple reasons. So first of all is hereditary. Second of all is when you lift a lot of heavy weights. Third, when you have cough and it's for long duration, and when you put lot of pressure while having cough, so they increase the pressure below in the anal region, which causes increase in the size of the veins. It is called as a venous enlargement in the anal region. Other most common condition where we see the hemorrhoids or piles is the pregnancy. In pregnancy, during pregnancy, the chances of hemorrhoids is more. Next, there are multiple factors are there, but these are the most important causes. The other important cause is that lifestyle. How is your diet habits? So most often when you don't have a proper liquid in your diet, then the chances of constipations are more. When there is more constipation, you eventually passes hard motions. While passing hard motions, you put lot of pressure, and then while putting pressure, you feel more pain, and then the size of the veins increase in size. Now, pathophysiology, how it happens. So the thing is, when we eat food and when we don't take proper amount of water with the food, and our diet is less in fiber diet, so fiber. So what happens is when the food goes into the intestine, the body wants water. If you are not taking proper adequate water, then what happens? The body tries to take all the water which is available in the food. So by the time the food goes in the digestion process and goes into the anal canal, it will be very rock hard because 99% of the water is absorbed by the body. Then what happens? People have most oftenly they'll having constipations, and then after 2 days when they pass motion, the stool will be very hard. When you pass, and to pass a hard stool, you need to put a lot of pressure. That's why when you pass motions, it feels more pain, and sometimes you might feel a difficulty in passing. Now, what are the symptoms? How will they present piles? So the piles there are two types of piles. It's internal or external. Internal will be inside, and it's grade 1 and 2. External will be outside. Can be visible to you. You can see, touch, and feel. So when most common symptoms of these piles are when you pass motions, then you feel bleeding from the rectum region whenever you pass motions, and you feel discomfort. So what you do next is you need to get yourself examined by a surgeon, and what he do is he'll do a per rectal examination, then do a proctoscopic examination, and sometimes we do a colonoscopy. It's like an endoscopy. We put a tube from the below and check for the hemorrhoids. So there are four types of hemorrhoids, four grades of hemorrhoids. Actually, you need to understand this. First grade is when the hemorrhoids is inside. This is the anal canal, and they are inside. This is the first grade. Second grade is when they come out when you pass motions, and eventually they go in. This is the second grade. Third grade is when they come out and then patient tries to push it inside, then even it goes inside. That is the third grade. Fourth grade is when it comes out, even though you push the hemorrhoids inside, it won't go. It will be outside. So that is the fourth grade. So depending on the grades, you need to be more careful about what to do. You have to go for a treatment. Now, what we do for the treatment of these piles. So we have open surgeries, stapler surgeries, laser surgeries. What we do is basically we cut out the hemorrhoids and remove it out. Either we can do by laser, we can do by open hemorrhoidectomy, we cut it and ligate the vessel and take out, or we have a stapler. Depending on the grade of the hemorrhoids, the treatment plan is changed accordingly. Okay. Why you need to be more worried about this is if the piles is not treated on time, then it can go for a complications. You might have continuous heavy bleeding from the perianal region. You will lose so much of blood. So, and if it is strangulated, it twists along its axis and it causes severe pain. You can't even sit for, and it's an emergency. You don't know when it comes. Okay, so whenever you are diagnosed, you feel you have some piles issues, then better you should show to a surgeon and get the treatment done. Thank you.